Respiratory syncytial virus, more commonly known as RSV. The RSV outbreak is currently in the United States. Our season runs from fall to spring, with winter being the most severe. RSV is a respiratory virus that infects the lungs and airway. It can also lead to other disease processes such as pneumonia and bronchitis. Signs and symptoms include a runny nose, decreased appetite, coughing, sneezing, fever, wheezing, sore throat, and headache. If shortness of breath, high fever, or blue skin is noted, seek emergency assistance. Pay particular attention to very young infants. Frequently, the only symptoms they show is irritability, decreased activity, and shortness of breath. There are things that we can do to prevent RSV and break the cycle of infection. Wash hands with soap and water for at least 20 seconds. Avoid touching your face with unwashed hands. Avoid people who are sick. Avoid close contact with others, such as handshaking, sharing cups, and kissing. Cover your cough and sneezes with sleeves or tissues, not your hands. Sanitize frequently touched surfaces and mobile devices, and if you are sick, please stay home. There is an RSV vaccine that is recommended for certain adults, adults greater than age 65, adults age 60 to 64 if it is recommended by their physician, and women who are 32 to 36 weeks pregnant during RSV season. For infants, we can administer a preventative antibody product. These are administered to infants up to 8 months old entering their first RSV season, infants between 8 and 19 months in their second RSV season, babies born prematurely prior to 35 weeks, and babies who are less than 6 months old at the beginning of RSV season. The Center for Disease Control and Prevention and Health Alert Network announced an increase of RSV cases in southeastern United States during the 2023-2024 season. So if you're planning to travel to any of those cities, use extra precautions. There are a lot of resources with information and assistance for RSV. National Foundation of Infectious Diseases implement a call to action for public education on RSV prevention and treatment. The Oklahoma State Health Department provides coordination with providers for infant preventative antibody products and vaccinations. The CDC and American Lung Association have easily accessible websites that provide a wealth of knowledge. I got my information from the American Lung Association and the Center for Disease Control and Prevention.